Hi, I am Dr. Ashutosh Misra from Enhanced Clinic. Today in this video we'll be discussing about liposuction. Though liposuction is a very vast topic to cover, I'll just make it short and brief so that you can understand what is liposuction, what are the myths with liposuction, and what should be your expectation about liposuction. Again, liposuction is a procedure in which we remove any excess fat in the body which is below the skin and above the muscle blade. Most common areas are abdomen, thigh, arms. It can be done from any area, face, calves, any area. Now, first of all, what we should know about liposuction is not a weight reduction procedure. It's a body contouring procedure. So we should not take liposuction to decrease our body weight. It is to make our body more contoured and a good looking. What we do in liposuction is we put in a tumescent fluid, which is a cocktail of fluids which contains an anesthesia and all, into the plane from where we want to remove the fat, and through small cylindrical tubes called cannula of various sizes, we remove the fat, and the fat is taken out of the body and collected into a jar outside. So once the fat is out, it cannot enter the body again. So this is the liposuction. Now, most of the time it's a daycare procedure. You come in the morning, go back home in the evening. It can be done under local anesthesia or under sedation or completely into general anesthesia, depending upon patient to patient, the areas that have to be covered, and how apprehensive the patient is, how good your facility is. Now, it should be done only by a very trained specialist, plastic surgeons who are trained for liposuction in a very good facility which has all the backups, and it's a hospital or a daycare unit. Coming on to liposuction, when people consider it as a body contouring or a weight loss measure. Now, treating it. Liposuction is best done for patients who are in their either normal body weight or slightly overweight, and they just want to get rid of some problem areas of the fat. This is the best, in which we can average remove around 1.5 liters, even 2 liters of aspirate, what we call, from the body. Then this procedure is just very limited. It can be done under local anesthesia. There is almost no downtime. You can be back to your work the very next day if you want, if the amount of fat which has been removed is such less. Now, when we are slightly overweight and we want to remove more amount of fat, say the aspirate comes to around 5 liters, then we don't call it as a simple liposuction. We call it as a large volume liposuction, and then it requires a downtime. Preferably, if we are doing a large volume liposuction, we tell our patient to stay overnight in the hospital, go the next day when they feel good about it, and there is a downtime of around 3 to 4 days. What I mean by downtime is, it's not that you are bedridden. You can just go around with your normal day-to-day activity, but avoid any strenuous work, because there is a slight amount of discomfort which you will feel, and a slight amount of fatigue because of this procedure that you feel. After 3 to 4 days, you're good enough to go back to your normal work. And again, if the liposuction is still larger than this, say the maximum amount in the safe limit, what we call it, is around 10% of the body weight. So if you're going for even larger amount, which should be actually less than 10% of your body weight, then your downtime may increase up to a week, 10 days. This is it about liposuction. Now, again, because the fat is lighter than water, even if you are removing around 2 liters of fat, you are not going to reduce 2 kgs, you will be going to reduce less than 2 kgs. But after liposuction, body is into a metabolic phase in such a way that if you go on for next 3 months doing a good amount of exercise, a proper healthy diet, then you may reduce even further because of your effort, because the body is into phase of metabolism that you rapidly lose weight with slight amount of effort that you give. So we always recommend our patient after liposuction to go on a very healthy diet and to go on as rigorous exercise they can, for like gymming, walking, running, yoga, so that they reduce even more weight, which they can reduce only with the help of liposuction. Now, another thing which people ask about liposuction is what happens to the saggy skin if the skin is sagging or more. Now, just to tell you, liposuction, what liposuction cannot do is, when we are doing liposuction, we are doing nothing to the skin. Liposuction cannot take care of the cellulite. Cellulite is like the bumpy appearance of the skin, because it doesn't deal with that area. Now, if the skin is very sagging, When we are doing liposuction, we are tunneling the whole of the area below the skin. This tunneling causes fibrosis, and fibrosis causes contraction of the skin. So if the quality of the skin is good, then actually liposuction causes contraction of the skin as well. So this is actually good. But if the skin is very hanging and the quality of skin is poor, there are a lot of stretch marks, collagen content is less, then it is less likely to contract, and then the procedure shifts to liposuction plus the excision of the sagging skin. Say in case of, if you are talking about the tummy area, then the procedure becomes liposuction plus removing the excess skin, known as a mini tuck procedure. If the skin is very hanging, very loose, then the procedure changes from liposuction plus an abdominoplasty, in which we tighten up the abdominal muscle and remove any excess hanging skin. Another common question is the result of liposuction permanent? The answer is yes. The new shape of body what liposuction gives is more or less permanent, and it continues to stay with you as long as you continue with a good exercise regime and a good healthy diet. If at all there is a weight gain or excess body fat, then it is deposited in proportion to what the body figure has been given. Most of the time post liposuction, you are motivated enough to continue with the same lifestyle or a healthy lifestyle, a healthy eating habit, so that the results are permanent for a very long period of time. The last thing is the result expectation with liposuction. Every person should be very realistic about what a liposuction can do. People have myth that remove all my fat from all of the body. No, it is not like that. All these surgeries have to be a very safe surgery. It should be done only by the expert plastic surgeon who regularly does liposuction in a very good facility which can handle any of these problems if they occur. And now coming on to the expectation, we can maximum what we can remove is around 10% of the body weight. But we don't have to go to the maximum. We can choose area wise, go step wise. We should not consider get me a whole body liposuction or get rid of the whole body fat. No. Choose your area of concern. Say tummy area, go for tummy first. Say thigh area, go for thigh then. So break these surgeries into parts so that you get the best out of it. If anyone comes, say remove my fat from arm, tummy, thigh, calf, everyone, I have a limited amount of fat that I can remove in a single time. So we'll remove small amount of fat from all over the body, and you won't get most appreciable result. To get most appreciable result, choose different areas of body at a time, get it done and get the best result out of it. Now again, talking about the types of liposuction, there are a lot of commercials and a lot of ad in net that people are confused, and they come and they just name a product. I want this liposuction, I want ultrasonic liposuction, I want laser liposuction. No, leave it to your surgeon. What is best for you? So he knows what is best for you. Having said that, now I'll tell you about there are normal liposuction which is done manually. There are mechanical machines which ease up the surgeon's hand by doing multiple suctions in a single pass. Then very common these days is ultrasonic liposuction, which comes by various names. Laser is one of the common names for this. Now ultrasonic liposuction, it is a good liposuction, but it has certain indications where it acts best. And your surgeon should be very expert in doing those particular liposuction. Coming on to the next is laser liposuction. Again, laser liposuction has certain indications that it works best. It is not that you come in for a liposuction, you ask directly for laser liposuction. No, let your surgeon decide what is best for you according to your problem, what you need the most. If you really need an ultrasonic liposuction, he'll recommend ultrasonic liposuction for you. Otherwise, if he feels like a normal manual liposuction is good for you, then normal liposuction can be good for you. All these extra machines we add on leads to an extra cost. If anybody asks directly to use that particular machine, we do have those machines, and then unnecessary you are charged more for that machine. So it's always best to go for your surgeon, and it is ultimately everything is result oriented. If the best liposuction is a manual liposuction, go for it. If your surgeon feels no, and ultrasonic liposuction will do good for this particular area, or you already had a previous liposuction, you're going into the area which is not virgin, then yes, ultrasonic liposuctions do help. Laser liposuction is good for tightening the skin, and when we are going very close to the skin, we need to reduce certain amount of cellulite, and also yes, laser liposuction will help. So get the recommendation of your surgeon what is best for you, rather than just saying I want this particular liposuction. Lastly, I would say that liposuction is a wonderful procedure. It boosts up your self-confidence. You can choose to wear whatever dress you like. You should have a very realistic expectation about liposuction, and it will do wonders for you. You will love the results. Only thing is, choose your surgeon wisely. You should know about him, his qualifications, and for how long he is doing this procedure. That's it. If you choose everything good, a good clinic, you will always be happy about it.